Good morning, student. I am Nirosha Senaratne from IHS. Today we will talk about our theory session. Topic is diabetic patient food care. First of all, I will talk about learning outcome of today's session. After end of the session, students, you will be able to following outcomes. First one is define diabetic mellitus and identify major diabetic complications. Second one is nurses' responsibility for prevention of food complications. Third one is risk factors of food problems. Fourth one is identify food ulcer, early identification, signs and symptoms. After that, physiology of diabetic foot ulcer. Another one is treatment of diabetic foot ulcer. After that, step of diabetic foot care, and finally patient and family members education. These are learning outcomes of today's session. After that, I will talk about the objectives of today's session. First one is educate the student nurses for diabetic food care. Second one is to give more knowledge about the health education of food ulcer. Third one is the student nurse promote for give proper care through the nurse's responsibility. Now I am going to talk about introduction of food care. Food problems are common in people with diabetic. That is more causes of help to eat. These problems include in food infection, foot ulcers, lower extremity infections, and sometimes maybe amputation. Therefore, need to proper knowledge about food care for diabetic patient. That is student nurses need to more knowledge of their prevention of food complications of this related. Student, I think you all know before session, before theory session, diabetic and its important factors and their related things. Now briefly I talk about what is diabetic mellitus. Diabetic mellitus is a group of common endocrine diseases characterized by sustained high blood sugar levels. Diabetic is due to either pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. These are definition of diabetic mellitus. Simply, diabetic mellitus is identify high blood sugar level in our blood circulation due to insulin insufficiency. After that, I will talk about diabetic major complications. That diabetic complications are divided mainly two types, such as microvascular problems and macrovascular problems. Microvascular problems are included in diabetic nephropathy, diabetic retinopathy, and diabetic neuropathy. Diabetic nephropathy mean of damage to the kidney and produce its related complication. Diabetic retinopathy means diabetic complication produce eye related and its complication. Diabetic neuropathy meaning of diabetic produce neurons related complication. These are long-term high blood sugar and uncontrolled diabetic produce complications. After that, I will talk about macrovascular problems. These are mainly diabetic foot problems, gum disease and other mouth problems, and heart attack and stroke. Macrovascular problems meaning of large vascular related complications, that is diabetic foot problems mainly related and today topic and talk kitten, gum disease and other mouth problems, and other macrovascular problems, heart attack and stroke, small to large complications of diabetic related. Student, now we'll talk about definition of foot care. Foot care involve all aspects of preventive and corrective care of the foot and ankle. That is, this foot care mainly focuses on diabetic patient, ankle and foot related. After that, I will talk about causes of foot ulcer. The causes of foot ulcer, more knowledge, information need to nurses, student nurses, idea about prevention of diabetic patient complication. First one is high blood sugar. Second one is irritated or wounded feet. Third one is infection. Fourth one is smoking. Another one is trauma. After that, poor circulation, nerve damage, foot wear, example of poor fitting shoes, deformities. These are identified causes of foot ulcer. The nurse's responsibility of help to prevent these causes, minimizing to prevent complication of foot ulcer. Now I am going to talk about nurses' responsibility for foot care. Nurses need to more responsibility for prevention diabetic mellitus patient foot complications, such as patient education, encouraging health promotion program, or any other health education related program, arrange and to give more knowledge to the patient, responsibility person of nurses. Firstly, I will talk about regular inspection and examination of the at-risk foot. Second one is education of the patient and family members. Third one is treatment of ulcerative signs. Fourth one is encourage routing, wearing of appropriate footwear. That is help to self-examination of foot ulcer signs, such as callos, infection signs, nail infection or any other infection signs. Educate the patient or family members, such as need to encourage patient and family members to prevent foot related ulcers or any other barriers of uh, this treatment of pre-ulcerative signs such as uh, give health education and instruction, initially identify ulcer signs of Putin to get a proper treatment of qualified doctors. Uh, After that, encourage routine wearing of appropriate food mean of diabetic patient, especially uh, long-term complication of peripheral neuropathy, such as not functioning nerve of peripheral side properly, loss of sensation, that is causes of uh, foot ulcer induced, such as sharp edges, uh, like any toe injuries. Identify that mean of appropriate shoes uses of everyday need to prevention of foot ulcer. Now I will talk about risk factors of foot ulcers, duration of diabetic, older age, uncontrolled hypoglycemia, peripheral vascular disease, peripheral neuropathy, trauma, history of prior ulcer amputate, limited joint mobility, prolonged elevated pressure, structural foot deformity, identify risk factors of foot ulcer. I think you will know about these risk factors related instruction. After that, I will talk about what are the signs and symptoms of foot ulcer. Burning and painful feet, swelling of the feet or legs, loss of sensation to cold or touch, thickening and yellowing of the toenails, the onset of red spots, blisters, sores, ulcers, infection corners or ingrowing toenails. These are initially signs and symptoms of foot ulcer. Student, please look at this picture. This is a diabetic foot ulceration pathways, such as diabetic patient having a main three pathway of diabetic foot ulceration produced. First one is neuropathy. After that, sensory loss, motor neuron dysfunction, autonomic dysfunction produce diabetic foot ulceration. Second one is vascular insufficiency. After that, ischemia, impaired wound healing produce diabetic foot ulceration. Third one is secondary infection, inflammation, impaired wound healing, reduce angiogenesis, produce diabetic foot ulceration. These are diabetic foot ulceration pathophysiology. Now I will talk about purpose of foot care. First one is to maintain mobility and function. Second one is to prevent ulcer. Third one is to prevent injury of foot. Fourth one is to promote early healing of foot. Fifth one is to prevent infection. Sixth one is to save from amputation. Now I will talk about treatment of diabetic foot ulcer. Identify main two type of treatment these ulcers. First one is conservative treatment. Conservative treatment included in bed rest, bed rest IV antibiotic, intravenous insulin pump may be necessary to control of blood glucose level. Second one is surgical treatment. Surgical treatment included in to drain pus and abscess cavities, to remove all necrotic and infected tissues. Necrosis has developed in the digit, so amputation is necessary. Skin grafting is needed to after granulation tissue has developed, which accelerated wound healing. These are main treatment and its important related things. After that, I will talk about complications. Complications mainly neuropathy, skin damage, skin changes, callosis, poor circulation, gangrene, and amputation. Student, now we'll talk about diabetic foot ulcer complications. First one is neuropathy, second one is skin changes, third one is callosis, fourth one is poor circulation, fifth one is gangrene, finally amputation. Now I will talk about step of foot care. First one is wash feet every day in warm water with soap. Second one is check feet and toes. Third one is moisturize dry skin. Fourth one is toenail care. Fifth one is footwear, shoes and socks. Sixth one is socks, wear clean dry socks. These are important step of foot care, and following images are widely appear in this step properly. Student, please you will see this image correctly. Feet, toes and ankle warm water and soap using cleaning method properly appear with this image. This is an important picture. Do not try to self-operational procedure of ankle or feet sides because of produce ulcer in or injury or unwanted defects of this operational procedures. This is a correct moisturizing agent used for feet. This image appear in correctly nail cut method to prevent skin edges damage. This is a correctly wear of socks. This is widely used for suitable socks. This image appear in avoid walking barefoot. This is an important picture. Do not try to self-operational procedure of ankle or feet sides because of produce ulcer in or injury or unwanted defects of this operational procedures. Any diabetic patient having bad habit of smoking produce unwanted effect of their life. Now I will try to explain family and patient education. These are important for prevention of diabetic foot ulcer. focuses on mainly few areas. First one is encourage patient used to covering shape comfortable shoes. Mm, uh, Explain to avoid walking barefoot and it causes of soreness or injuries. Mm, After that, explain protect feet from heat and cold. Another fact of never use heating pad, hot water bottle, or hot blanket or any other hot related things for feet. After that, explain antiseptic solution do not use for skin clear or cleaning or related procedures. Now I am come with conclusion. This is included in my presentation. All focuses area of related to food also in diabetic patient. Now I am give to you a few questions related my presentation. I am try to answer discuss for few minutes.